Hello, this is Scott, and this is another lecture in the Transgender Health series that focuses on the basic introduction to the different transitioning options for a transgender patient. For each of the options, you should be able to explain to your patient what are the options, what are the risks, and how do they receive treatment. There are three major types of transitioning. There's social transitioning, medical transitioning, and surgical transitioning. Social transitioning is the most basic form, and it's beginning to live as the identified gender through non-invasive methods. This includes dressing as the identified gender role, asking to be referred to as preferred pronouns, and can also involve psychotherapy either at the individual level or with a couple or family or group in order to explore the gender role and gender dysphoria more completely and help to alleviate internalized transphobia. Internalized transphobia is the internal hatred of trans people despite being transgender due to societal conditioning. The next level of transitioning is medical, which is considered to be a partially reversible transition through the use of affirming hormone therapy and puberty suppression agents in order to more phenotypically present as the desired gender. Surgical transitioning is irreversible and includes top, bottom, and non-genital surgery. Top surgery may be mastectomy for transgender males and breast implants for transgender females. And bottom surgery includes vaginoplasty, hysterectomy, metoidioplasty, which is the conversion of a hormonally enlarged clitoris into a neophallus, scrotoplasty, and phalloplasty. Non-genital surgery spans a lot of cosmetic procedures, such as voice surgery, shaving Adam's apples, changing body curvature, pectoral implants, stuff like that. In order to undergo hormonal and surgical transitioning, it's required that patients have a diagnosis of gender dysphoria, which is incongruence between someone's experienced gender and natal gender for at least 6 months of duration, as manifested by a strong desire basically to live as the opposite gender. This is the full criteria based off of the DSM-5 as related by the WPATH guidelines. In order to get hormone therapy, a patient must have documented gender dysphoria, which has been persistent. They must be the age of majority in their given country. They have to have capacity, and if there are any significant medical or mental health concerns, they have to be reasonably well controlled. In order to get gender-affirming surgery that affects fertility, there must be gender dysphoria. They have to have continuously and responsibly used gender-affirming hormones for at least 12 months. This is a huge barrier of care for people who identify as non-binary, who want to undergo some sort of gender-affirming surgery, as it's unknown how this criteria affects the non-binary status, or is affected by the non-binary status. They have to demonstrate that they know the practical aspects of surgery, costs, hospitalization, complications, rehabilitation, and an understanding of outcomes. In general, insurance will cover medical and surgical operations for treatment of gender dysphoria as long as the patient meets criteria outlined by WPATH and the Endocrine Society. This is a clip from Aetna, which shows that many of the non-genital and non-top surgeries, such as body contouring, feminization, hair removal, lip enhancement, stuff that will help the patient more phenotypically present as their identified gender, are not covered by insurance. It's the very basic surgeries that are covered. Both WPATH and Endocrine Society recommend referral from one mental health professional specializing in transgender care for gender-affirming surgery that doesn't affect fertility, and 2 referrals from mental health professionals that do affect for surgeries that do affect fertility. Many transgender patients and providers find that these referrals are a limiting factor for access to care. There are not many mental health professionals specializing in transgender care. Many insurance companies won't accept outside referral and require an internal validation process. And so it's very hard to get coverage for gender-affirming surgery for many transgender patients, as a lot of these mental health professionals that do specialize in transgender care, the insurance companies don't think that their referral is good enough. Overall, gender affirming interventions increase mental well being and decrease gender dysphoria. Both hormonal and surgical treatment of gender dysphoria has been found to be effective in decreasing rates of depression, anxiety, and suicidal ideation.